There are few things that make a person get as mad and as self-conscious as a fever blister, also known as a cold sore. People just hate them. Well, I'm going to set the record straight on what they are, how to treat them, and most important, how to prevent them. These sores are fairly common, but they have nothing to do with a cold. They typically appear on the outside of the mouth or on the lips. The majority, about 95% of fever blisters, are due to a virus, herpes type 1. This is not the same thing as genital herpes, which is herpes simplex type 2. Genital herpes is contracted by sexual intercourse. In the U.S., by age 50, HSV-1 affects 80 to 90% of the population. More than 50 million adults in the U.S. develop symptomatic episodes every year, which is why you see so many TV commercials that try to sell you some type of cream or some type of device to cure them. If you get infected and start to develop cold sores, there's generally a recurrence that can vary from rare episodes to 12 or more recurrences per year. People with the condition typically experience 1 to 3 attacks annually. The frequency and severity of outbreaks generally decreases over time. So how do you get them? Well, adults are typically exposed or infected via contact with someone who has a fever blister that they kiss or shake hands with, and children are exposed by other children who mouth toys or other objects that may have been contaminated with the virus, or an adult who is in close contact with the child. That's why I always tell you guys, don't just use that hand sanitizer, because those sanitizers, for the most part, don't kill virus. You actually got to wash your hands. After initial infection, the viruses move to sensory nerve cells in the cheeks called the trigeminal ganglia, where they reside forever as dormant viruses. Asymptomatic shedding of contagious virus actually can occur during this stage. Symptoms typically begin with tingling and itching and reddening of the skin around the infected site. You must remember that once you feel this, you are generally infectious. This stage can last from a few days to a few hours preceding the physical manifestation of an infection, and is the best time to start treatment. You will then start to develop small, painful vesicles on the lip. The most painful and contagious of the infection is about day 4, when all of the tiny vesicles break open and merge to create one big open weeping ulcer. Fluids are slowly discharged from the blood vessels and inflamed tissue. This watery discharge has a lot of active viral particles and is highly contagious. Depending on the severity, one may develop a fever. Then a scab, which is not made of active virus but from blood serum containing useful proteins such as albumin and globulins, forms as the healing process begins. The sore is still painful at this stage, but more painful, however, is the constant cracking of the scab as one stretches the lips, as in smiling or eating. Virus-filled fluid will still ooze out of the sores through any cracks. New skin begins to form underneath the scab as virus retreats into latency. We're going to discuss what to do about these nuisances in part 2 of this series, so just keep it healthy with your favorite doctor, Dr. Corey Hebert, for BlackHealthTV.com.